You're watching Optimizing Surgery Preparation and Recovery by Dr. Alyssa Gall with special guest Coach Josie Astley on Resonance Wellness TV, part of our Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com. Good evening, everybody, and welcome to our webinar. This is called Optimizing Surgery Preparation and Recovery. And I am so happy to welcome Josie as a co-presenter tonight. Josie, you might know her from Concept Fit if you are part of the Align Fitness group. And I'm really excited to see what she has to say today about how we keep strong during surgery preparation and recuperation. So just as a reminder, all of our webinars are under the title of Whole Life Medicine, and this is another Alleviate webinar, which means that we're taking a look at missing ingredients, clean slates, so how to keep eating clean and keeping detoxification going, which is going to be crucial in surgery, and also attending to some root cause issues like, do we know we're heading into a surgery with an inflammation or with a sensitivity, and what do we need to do about those things so that we have the absolute best experience possible. So we are going to start by having Josie introduce herself and tell everybody about herself. And so Josie, take it from here.
Yeah, thank you very much. All right. Thanks everyone for having me. Okay, this is a great topic point. I'm looking forward to diving into this a little bit from my profession. So I really, from being a physiotherapist, being a strength coach, working with patients preoperatively and postoperatively and beyond, I've kind of broke it down into a few key elements that I think is really important for optimizing surgery successes, feeling prepared, and essentially being more confident before you go in. So I'm excited to break it down for you a little bit. So a little bit again, I'm Josie. I'm a physiotherapist and strength coach, co-founder of Concept Fit. Marcus, my husband, and I together run Concept Fit, and we love to merge our professions to essentially help people live a physically free life, one with longevity. And we're able to do that quite well just by merging our specialties. So for myself as a physiotherapist, I've dealt with generally a lot of musculoskeletal injuries, knees, total knees and hips, knee ligament injuries from ankles, shoulders. So I have a lot of great hands-on experience in terms of what preoperative work looks like and post-operative work. And I'm excited to dive into some of the research on what is important when it comes to preparing your mind and your body for surgery and post. So first and foremost, surgery is only part of the outcome, right? And your body and habits are going to influence your recovery and speed. And it's really important to know that stronger, more prepared bodies are going to have better outcomes post-operatively, right? And that's talking about that prehab, the work you do before surgery. And that's not necessarily the work you do weeks leading up to surgery, but the months leading up to surgery. And that's going to really improve your function and reduce your complications. So I want to break it down into 3 components of a framework, kind of like the surgery success framework. First, it's the prep, right? It's the prehab. Second, it's the recovery. So kind of that acute stage after you've had that surgery. That's that rehab we're all kind of dialed in on. And then there's a third component that I get really excited about educating, and that's that rebuilding. So that's actually working past the point of recovery and building into prevention. And what I'll see as a physiotherapist and honestly as a strength coach is that most people are focusing on the rehab and they're forgetting about the biggest component, which is what happens and what you need to be doing before. So let's talk about pre-surgery, the first component of our framework. One of the first things I want us all to kind of just put in the front of our brain is the importance of going into your surgery educated and informed. And this is not just kind of reading the workup notes and understanding your procedure, but really know your expected timeline, understand restrictions, whether that's weight bearing, what we need to be avoiding. And what we're learning is that when patients go into surgery with more education, that improves your adherence and it's going to improve your outcomes of that surgery. And if we think about it, right, more clarity, more confidence, it's going to reduce that fear and build a better recovery behavior. And one of the things I tell a lot of my patients leading up to surgery is if you have questions for your surgeon, they typically pencil in a very short amount of time for your appointments preoperatively. So go in, write your questions down, and head to that appointment with a piece of paper. Then you can get the answers you need with the questions written down, and you kind of go in and kind of control some of the conversations. So you get those answers, and that's part of being educated and informed and a bit in control of the time leading up to surgery. Okay, setting up your environment. Now, this is where you might need to do a little bit of a house evaluation, but really this is a very important component of supporting yourself post-operatively. Preparing your sleep and resting areas. So having a good chair you might spend some more time resting in, a good chair that's not comfort, but also posturally supportive. Knowing where you're sleeping, right? Making sure there's easy access to essentials, the bathroom, the kitchen, right? Just knowing that you're not having to track up and down stairs to use a washroom and whatnot. These are all really important components of setting up your environment. Reducing falls risks, right? Get rid of the shaggy carpet if you feel like you're gonna have some mobility restrictions with a lower limb surgery. Getting rid of shoes that are just in high traffic areas. Planning support, right? Knowing who can help out with kids and rides, a meal train. It can be hard to ask for help, but these are all part of the life logistics that are very important for making that recovery easier and essentially allows you to just dive in on you and your recovery, and that's going to really optimize and improve outcomes. Okay, this is one of my more, I'm really passionate about this slide. So building your recovery reserve. I want to talk to you about what a recovery reserve is. And it's really the time you dedicate, the months leading up to surgery that you dedicate to building up the strength, building up your mobility when and where you can, building up your cardiovascular fitness, right? Maybe you're getting a total knee replacement done and you actually can't walk a ton because it's just too painful. Maybe you get on a bike and you do your best on activating and getting some cardiovascular fitness and maintaining it. It's practicing movement patterns, okay? That's that neuromuscular control. If you're getting a hip done or ankle surgery done and you're going to be limited on how you do getting in and out of a chair, practice your sit to stands, practice your stair climbing, the balance and the stability beforehand. Build up that neuromuscular feedback because that is you building up that recovery reserve. And most surgeries are going to have a period of rest, bed rest, or immobilization. And with that comes muscle atrophy, which is when our muscles, we basically lose muscle size, lose muscle in general. Depending on how much time you spend immobilized will dictate how rapid your muscle atrophy is. So if you go into surgery with a bigger recovery reserve, you're starting stronger. Therefore, you're going to have less loss and a faster recovery. Now, I know when we are prepping for a surgery, there might be limitations in what we can do with building the recovery reserve. So that's when connecting with a physiotherapist or maybe a specialized coach and building a little program or a support that fits exactly what you can do. We're working around soreness or limitations, but we're still targeting these areas can be really, really powerful because this prehab is going to significantly improve your post-operative function and your muscle strength. And going into surgery as strong as possible is really important and not just waiting to rebuild after. So don't underestimate how important it is to build this reserve before, and it's going to take some months to do so. So don't overlook sleep quality, nutrition, hydration, stress management, right? When we think of a surgery, there's going to be healthy inflammation post-operatively. And if we have more inflammation on top of that, where stress can be a form of adding inflammation into our body. So if we learn some stress management strategies beforehand, that can help our body maybe just focus on the inflammation we want it to. That can be an important component of your recovery. Studies have found that poor sleep quality was significantly associated with delayed wound healing after surgery. And along with that, like when we think about your protein intake, higher protein intake is associated with improved wound healing and better recovery outcomes post-surgery. So really, recovery does happen at that cellular level, and all of these little things can support that. Now we're going to talk about post-surgery. And realistically, we're kind of talking about like that rehab plan, whether it's months or years or weeks, or a 1 year typically, or weeks post-operatively. This is what I think is really important for us to be thinking about and preparing for. And the first one is to know your rehab plan. So it can be really powerful to go into surgery already gently understanding about what your rehabilitative plan looks like. Everything from a timeline, when you're supposed to see a physiotherapist, knowing when to rest, even just clarifying what can you do versus can't do. That can kind of just eliminate all the questions you might have post-operatively because you've answered them beforehand. Uncertainty is going to slow your recovery down, but clarity is going to be obviously accelerating it. So knowing that rehab plan beforehand can be really powerful because you're probably going to feel overwhelmed post-operatively with just pain and how things are feeling. It can be hard to throw on learning at the same time. So the next great slide is about just don't guess your rehab. So when we talk about wanting to have the best outcome post-surgery, guided physiotherapy can be a great place, right? That's going to improve your outcomes. When it comes to muscle atrophy, right? Or we've lost our balance, we've lost some mobility, right? Joints are stiff because we've had this period of crutches, rest, bed rest, compensation patterns. It's going to be really, really important for us to learn, how can I rebuild my strength and my muscle back post-surgery? And this is where we need to understand that in order to create some tissue repair and support remodeling, support collagen alignment, we need mechanical load. So muscles, ligaments, they need load to repair. That is how bed rest is so significant when it comes to muscle atrophy, because that's a period of literally no load. And this is where early appropriate movement is really important, because when we start to build our muscles at the earliest point that we're cleared to, that's going to help with improving the collagen alignment, activating muscles, getting that tissue repair. And when we have a guided physiotherapy or a clear support plan, they're going to guide you through understanding what progressive resistance training looks like and how important that is for you post-surgery, getting that strength and movement and function back. And intensity, learning what sufficient intensity is over time to stimulate muscle growth and keep that adaptation happening. Consistency, what does that look like? How consistent do you need to be to create said adaptation? And then just making sure that that all plays a key role in making sure the protein and the recovery supports are there. So essentially, supervised exercise is going to produce greater improvements in muscle strength and physical function compared to unsupervised programs. And I will see this often in the clinic. Patient who's in my clinic in the most acute stage, but they've got that clearance and they're here to do a little bit of something, anything they can. That's a great place to have that guidance, get your answers, versus maybe waiting, maybe a little bit too long and coming in and having to have a steep learning curve and really working through. So really that early mobilization after a musculoskeletal injury and surgery is going to lead to a faster return to function and improved outcomes. And just remembering that recovery is active and not passive. So it's really about showing up consistently. It's remembering that small efforts are quite meaningful and create meaningful results over time. It's important to understand that a part of your recovery, there's going to be ups and downs, right? You're going to walk too long and do too much one day because you feel like you can, and it's going to swell up that joint or feel like you create a little bit of more pain than you're used to. And just understanding that sometimes pain doesn't always mean damage. In many cases, it might just mean your body's adapting to the stimulus you gave it. Maybe you gave it a big stimulus and it's adapting with telling yourself that, you know what, that was a bit too much, Josie. please don't walk like that at the grocery store again. Give it a rest and try it again in a few days. So pain is your body's signal, respecting that. But then also, if you're unsure, get the clarity, ask the questions, whether it's from your post-operative nurse or your surgeon or your physiotherapist. So 3 great points of contact for you. And that active mindset is so powerful with your recovery. If you are bought in and doing your exercises and being aware of your posture and optimizing your nutrition, right? You're actively involved in all these components. It's going to really significantly and positively impact your recovery than if you had a little bit more of a passive mindset. So lastly, it's about that rebuilding, that 3rd phase of our framework. And it's really, really important for me to teach, and for Marcus, this is what's so vital, is please don't strive to just return to that baseline. When you feel recovered, when you feel like your right leg is as strong as your left leg, or you're back doing your daily tasks, that's incredible. But now's the time to rebuild and get into a point of prevention. So just get stronger, and also understand what led to this injury, or maybe what could I have done before that maybe put me at risk of further irritating my knee, increasing that arthritis. Should I look at improving my movement patterns? Should I look at improving my balance so I didn't have that fall? Focus on addressing what maybe led to that injury. What could you work on? Build up that strength, build up your resilience. A strong body is going to do a lot more in life than a body that doesn't have that strength. And that applies to balance, movement patterns. You want to feel confident, and you want to be able to do things better than you did before, and that's trainable. So really strive for rebuilding, focus on that prevention, because it's just, you want to think it's time for me to get my body in a place of strength and not just right where you were pre-surgery. All right, thank you very much for letting me take the floor initially, and I think Alyssa's now gonna carry on with her specialty.
Yes. Do you want to also tell everybody how to find you if they need some help with this?
Yeah. So I know it's a great, so you can get a hold of Marcus and I, whether that's through our website, conceptfit.ca. Email is a great place. If you just fire us an email and you have a surgery coming up, or you're thinking you're on the wait list for a hip and you're like, I want to optimize things, email us and we can kind of point you in the right directions of support, whether that's physiotherapy or exercise or a bit of both. So our email is conceptfitco@gmail.com. Those are probably the 2 best places to find us.
That's excellent. And I'm so glad that you were talking about clarity, because I think just having kind of gone through the process, both like with the people that are your providers and also kind of like getting it sorted out in your head is super key. So you also have a pretty good sense of what the time schedule is going to be like. So I think it can be surprising if, and also can be enlightening, because if somebody gives you what the average is and you're actually doing better than average, it's reinforcing too about how much work you did beforehand. So
absolutely.
I really like the whole idea of clarity. Awesome. So I'm going to add to this a little bit from my perspective. So if you're watching this video and you don't know who I am, my name's Dr. Alyssa Gall. I've been practicing naturopathic medicine in Calgary since 1998. So we're getting up there in years this year. So I have a lot of experience with helping people prepare nutritionally for surgery in the context of my very intergenerational family practice. So I wanted to talk today mostly about the nutritional and dietary strategies and some of the practical strategies that we can use to help ourselves recover from a surgery or procedure. And I think the key part really is that healing really needs nutrients. Healing is a very intense business. There are a lot of moving parts when you have had a wound. And I put this diagram up here. This is actually just wound healing. So it's not even showing like full on surgery. This is just kind of more of a skin insult, but it'll still give you a sense of like how much it actually takes. So here you can see in the first slide, in response to any injury or surgery, which is at the end of the day just an intentional injury with, some thought behind it. Um, an injury in the skin and through the tissues will have a big gap that is normally filled first with blood, and it's held together usually with stitches. So blood is a really interesting thing to be in contact with the tissues. It actually starts a major inflammation, all of those little bleeding parts up against each other. And it's partially the blood that's delivering and the interruption in the skin and in the other tissues that's attracting the inflammation itself is attracting all sorts of white blood cells and building cells, reparative cells, right to the site where it actually needs the repair. So here you can see in the second, I don't know if you can see my cursor, but there's in the second layer here, you're seeing a bunch of different kinds of white blood cells and building cells showing up. So here you're seeing something called a macrophage. So this is something that once you've had an injury, macrophages are the kinds of cells that come in and they clean everything up. So this is part of your immune system that is responding really to the injury itself. And this is always something to consider because if you already have issues with recuperating from inflammatory disorders, sometimes this can be a bit slower. And if this is the case for you, then ideally we would know that about that in advance so we can actually make a few tweaks to the surgical profiles for you. Also, what you're seeing here is you're seeing big cells that are called fibroblasts. Now, these are cells that actually are literally rebuilding your collagen and connective tissue matrices. So they come in a little bit later after the macrophages has cleaned up and they start to build nets of new connective tissue that eventually retract and pull the edges of the wound back together. So it's a very active process and it takes a lot of nutrients to remodel and replace all of those cells that have temporarily gone missing in that gap. Now, the other thing I just want you to notice here is there's this division here between the subdermis and the epidermis. So this is the skin, and the skin, even under optimal conditions, takes about 30 days to revise from its bottom layer. So it's generated from a bottom layer, and this is why you actually have technically the new cells slowly moving up because you're growing cells from the bottom of this red layer. And so as you do that, they actually rise to the surface. It's actually mostly dead cells by the time you get to the top. And the reason for that is that forms part of your waterproof barrier. And you're going to have to reestablish that barrier once everything is healed back up. Epidermal tissue is also, like, as we probably know from all these beauty things that we see online all the time, there's all sorts of nutrients and molecules that we actually use for making the most beautiful remodeling, even if that remodeling is just the day-to-day remodeling of our skin. So you can imagine just how much more is actually required when we fill in a gap and repair tissues that are not visible that are underneath the skin. But I thought this diagram gave you a pretty good sense of like how much is actually happening, even just on like a half a layer here, shown in wound healing. So what I have noticed over time is that most people, generally speaking, don't get the full range of nutrients that they're actually going to require for optimal surgical healing outcomes. And of course, for those of you who know me, this will risk sounding a bit like a broken record, but at the end of the day, the best diets on the planet in general are about, so if you put everything you ate on one big disc in the day, half of that disc would be covered with non-starchy vegetables in all the different rainbow colors. About a quarter of it would be your fats and proteins. So your meats, your eggs, your nuts, all of those things, your oils are all going to be in that corner. A percentage point of salts and or seaweeds for your mineral content and electrolytes. A percentage point of natural ferments. So things like a tablespoon of sauerkraut. All of those natural ferments actually are a much cheaper way of keeping your microbiome up to snuff. And it's a source of many prebiotics and probiotics. And again, Always works better when done consistently through food. And then in the last quarter, it will be about an eighth of fruits, again, different colors, and about an eighth starches and starchy vegetables. So when you look at a diet that's constructed like that, there are so many different molecules that are present that we actually use in the production of collagen and collagen cross-linking. So here, this is just a diagram that's showing the various kinds of collagen. So collagen is one of the main types of structural molecules that is in the healing process. And you actually make multiple different forms of collagen depending on what tissue it is and what layer it is. And collagen is a molecule that actually requires, it's a long, skinny molecule, and those long, skinny molecules are generally bonded to each other with cross-linkage factors. And the cross-linkages, which I'm going to show you in a second, are very nutritionally driven. So you can actually improve the structure of a tissue based on like what bioflavonoids, as an example, you're getting in your diet, or if you're intentionally putting them in from a certain source. And I'll talk about that in just a second. But what I have noticed is, like I said, you're not going to get the full range of nutrients in a kind of very white and brown diet. That will affect outcomes. And so we're going to talk about how we can best do this here in a second. But like I said, from a grand scheme of things, the diet that we have always been talking about in the context in pretty much every illness and every chronic disease that we have discussed on any webinar series or event is really comes down to that making sure that you have those proportions right. So like I said, the main collagen healing factors are, a lot of them are the colored compounds found in fruits and vegetables, but there's also antioxidants and minerals. So an antioxidant can be things like your vitamins A, C, E, and minerals, predominantly selenium and zinc. And like I said, these colored compounds. And what all of those compounds do together is they actually help bind collagen fibers together with cross linkages. So how I would want you to think about it is that if you have a set of collagen molecules stacked on each other, the ideal thing is that when that tissue is pulled apart with a tensile force that would pull the fibers apart, there are enough cross linkages to help it snap back together and to organize in a nice, straight, like linear way. When collagen is, or when connective tissue is damaged, if you don't put enough tensile strength in it, you actually will have like kind of a mix, a mishmash of cross linkages that can scar open. But like Josie was saying, if you can do some prehab and some rehab, putting a little bit of fascial directional tension on muscles or connective tissues actually help those collagen molecules to orient properly to the way that they're supposed to move in your body. And then if you have all these beautiful cross-linking factors available, the collagen that you're producing and depositing is going to be much, much stronger. So anytime you have more cross-linkages, you have a stronger tissue at the end of the day. And you can even do this if you're not injured. So say, as an example, if you are prone to ligamentous injuries or you have varicose veins, that's another kind of set of collagens. There are certain molecules you can actually put in to improve the structure, even if it isn't an active surgical wounding. So just imagine what that can do when you already have all these processes that are actually aimed at healing and having all of those molecules on hand. I do have a surgery preparation handout, and for those of you that know, there's the whole-life-medicine.com site, and there's a group of resources on there. And on the Essential Handouts site, you'll actually find the surgery prep outline handout. So I haven't printed it all out here, but I gave the start of it so you'd recognize it. And on this handout, we talk about a couple of different things that are really key in advance. And so usually about 3 to 4 weeks prior to your surgery, you're going to prep by putting all of these nutrients in. Now, ideally at the same time, we'd be aiming for a diet that has those nice proportions. And what you'll see on page 2 of this particular handout is actually those plating proportions shown, and then how are they going to change as we get closer and closer to the date of your surgery. So I'm going to talk about this in a second in a little bit more detail, but in essence, this is a list of all the nutrients that we're going to use. So we're focusing basically on the things that have the highest need to be in storage when you're going into a surgery. So like I said, you can take a look at this handout, but I'm going to just describe certain aspects of it here. So like I said, in the week before surgery, you actually want to start to decrease the amount of food that you're eating. Now, this seems a little bit counterintuitive, but if you've actually prepared a few weeks in advance and you've done a good job of like eating the rainbow and getting all that protein and all those good fats into your diet very consistently, then in this last week, we actually start to shut down the amount of carbohydrate and actually the amount of like heavier fats and proteins. Now, why we do that is ideally what we want to do is swing towards a semi-fasted state as we're actually coming into surgery. And the reason that we want to do that is because it brilliantly creates what's known as autophagy. Now, you might have seen this before if you've seen one of the fasting webinars. But in essence, when you reduce your food intake, there are natural body cleansing processes that come up in activity. And in a true fast, and this is one of the benefits of fasts where the caloric intake is low enough to actually start this process, the body will start to actively get rid of old stuff. And so old cells like turn over tissues that haven't turned over for a while, get rid of basically cell debris, and it just does it way more efficiently when you're fasting. So when you already semi-fasting, when you're coming into that last day, now it isn't atypical, of course, for the in a surgery to be asked to fast at least for a number of hours before your surgery. Usually it's like stop eating at midnight the day before your surgery. Depends a little bit, of course, on your surgery, how that feels to you. But ideally, if you can do this reduced fast with keeping the quality really high and multi-proportional, then you're going to have all the nutrients that you actually need and this state of autophagy as you're coming into the surgery. And then past the surgery, in essence, you're going to do a gradual reintroduction. Now, I'll tell you, there's a couple other advantages to doing it like this. And one of them is that you will have a much lower requirement, usually, for pain medications. You will have a much better time of coming out of anesthesia if it was used, because your body is totally loaded with the things that you actually need for detoxification under these circumstances. And you haven't overloaded the gastrointestinal tract and made it full of things to do while you are heading into something that is a really intense healing process. So it turns out, and this is true, we've also talked about this in terms of illness. If you have a fever is a major metabolic inflammatory state. Its intention is to actually mobilize the immune system and fight off whatever invaders are having an impact on you and help you to do all these defense systems that you see, like producing more mucus and, like pumping different blood into areas that you actually need the support so that your immune system can be delivered to a certain location. Well, it turns out that if you actually go into a surgery, again, in the semi-fasted state and you're well supplied, then your body has this amazing ability to actually launch right into the repair. Now, if you have a bunch of undigested material in your guts, and you kind of arrive that way, and then you do all of these procedures, and then you're heading into your recovery, your body has to do something with what's in your guts. And that actually can make people extremely nauseous when they wake up from anesthesia because they didn't have a chance to actually clean everything out prior to their surgery. So when you, though, have reduced your diet and it's down low and you might only be maybe doing on that last day, fruit and vegetable juices and lots of fluids. Always want to do lots of fluids. Just like Josie said, hydration is important. And you know that I am definitely the water Nazi around the office. So these things actually set you up for needing way less interventions. And it's amazing the difference to surgeons between the people who do something like this and the people who don't. Now, I've written here on pain management. Pain is something you don't actually want to try to catch up to. Now, I have lots of patients who don't love using pain meds or drugs. And there's a lot of people in my practice who very rarely would even use something like that. They really have to be in a bind to use it. But it turns out in surgery that if you are like post-surgical pain is not a normal pain. It's not your normal headache. It's not your normal, like, I fell down and hurt myself. It's like a fairly major intentional injury. And it's a kind of subquality of pain that we actually want to get ahead of. That's the term that's used. So if you take pain medications up front consistently, you will almost guaranteed use way less pain meds overall during your recovery. And so you actually save yourself from having to take too much of it. You don't try and tough it out and then have a lot more trouble trying to actually get enough pain meds in to like calm things down, because the body, like we were showing in the healing process, it's an inflammatory process in the beginning. So that inflammation, we want that inflammation to be there, but we also want to just hem in the pain so that it doesn't feel excruciating to you. So there's lots of things naturally that you can put on top of that. You know, people have heard about trauma care cream. That's easily available. It's a top like 10 homeopathics for injury, and that can work like a charm around your surgical site, you know, as close as you can get. You can use essential oils. There are a fair number of essential oils that are actually quite effective in pain control. With nerve pain, as an example, you can use lavender. It's something that works very well even in burns. So anytime that you have that kind of nervy pain in the skin, you can try lavender. And there's many like we use Muscle Mend, which is kind of a blend of different topical essential oils that can help with a little bit of anesthesia and pain control. But these are easy things that we can actually add to the pain meds to make them more efficient. There is the consideration of using neural therapy, which, if you don't know what that is, that's a surface injection in the skin of Procaine. This is it's a very old technique. It's been around for about 100 years. I learned it from an MD PhD that brought it overseas from Germany many, many decades ago. And this is a brilliant technique if you really get stuck in pain. I have definitely used this in times where people are in pain and we actually cannot access the site because the site is casted. And especially if it's a limb, we can actually use the other limb reflexively with neural therapy to calm down the pain in the casted limb. So if you get stuck in a set of conditions where you are really having difficulty with pain control and you're at the max meds, then you're going to need to ask about neural therapy. Now, another thing that I want to really emphasize is that bowel movements are key. There are many pain medications that really create significant constipation, especially opioids, and this can create a problem all the way to fecal impaction, meaning that the stool is so packed in there you're not getting it out. This is incredibly painful and it is totally preventable. So a lot of the dietary changes leading up to surgery will basically prevent this, but so will being prepared with constipation medications or supplements, especially if you have an unexpected medication change. So if, as an example, they start you off with a Tylenol or a T3, sometimes they might change that to something a little bit more intense. And if it's more opioid based, then we sometimes see a constipation problem. So if you know that that's going to be the case, or even if you don't, if you just make sure, as an example, you take some extra magnesium, or, you know, worst case scenario, maybe have some Restorelax on hand. Restorelax is basically a powder that greases stools out. So if they kind of get stuck and impacted, it's nice to combine with magnesium to see if you can actually get the stool moving again. There are things also that improve motility incredibly, things like raw ginger. So eating a cubic inch of ginger in a day improves motility in the cleansing waves that go down the intestines. So all of these things can be safely used together. and help you to get through any like slow moving stools. And if you're prepared for that, it's way less likely to happen. If you're not prepared, like I said, it can be very painful and take a little bit of time to get over when you're already in pain from something else. If you also have had antibiotics with your surgery, that very much changes your microbiome, and it actually takes about a year after a major course of antibiotics to completely see your normal flora recover. So we have a couple of options here. The non-messy version is considering probiotics for the recuperation period. Um, and you might want to just ask if the surgeon has an inkling that they'll probably be giving you antibiotics for that particular surgery. Not all surgeries actually you're going to get antibiotics for, so make sure to clarify that. The other thing that actually really helps with microbiome recuperation, which is kind of the grossest thing that you can do, but works within 24 to 48 hours, is to actually take a sample of your own stool, freeze it or put it like in a refrigerated location, and then after surgery, you actually use a bulb syringe to reintroduce that into your colon through your own rectum. If you do that, you will completely recuperate your microbiome after the antibiotic course within 24 hours. This is one of the, when you're doing your auto-inoculating your own stool, you're basically getting your own bugs back. This is actually a procedure that's used in severe inflammatory bowel syndromes where healthy people actually can be screened for a healthy stool, and they actually reinfuse it into people who are really having difficulty with inflammation problems. But it actually works so well that it can reinoculate a more normal microbiome and change the immunology of somebody who has inflammation. But like I said, you can use the version on your own. It sounds a little gross, but if they're going to be giving you a lot of antibiotics, it's something to consider having on hand. I also wrote down here, and I think Josie would probably agree with me, movement of the abdomen really helps bowel movements. So even if you can't move your limb, if you could just, do some like torso movements, do a little bit of crunches, see what you can do to just kind of keep the rest of your body moving, even if you have a limb or an area that's not really working well. The other thing you can do is you can gently in a clockwise fashion, rub your tummy to your comfort level going in a circle. That also does help to stimulate bowel movements. Another thing to consider is that if you actually have DNA results, this can really help to key down a couple of things that will be more like matched to you in your recovery phase. One of the things that's really useful in DNA is that you can actually run a panel that shows medication efficacy. So for things like pain medications, types of anesthesia, anti-inflammatories, the way that a person's body handle those is actually genetically dictated. So it has to do with how well you detoxify certain compounds that come in as foreign molecules. But it can also tell us a lot about whether or not you just tend to have a bigger inflammatory response overall, or if the stress of it should you're better at like activating your HPA axis, which is the part of your physiology that launches the stress response and maintains it. If we know those things about you, we can actually support those things, especially during major surgeries. In some people, if we know what the detox enzyme is doing, it can tell us whether or not the amount of drugs that you're going to get needs to be higher or lower as well. There are some people that just inherit the ability to like quickly detoxify a pain med, and certain pain meds, if you're detoxifying them really quickly, they actually just don't stick around long enough for pain relief. So in that, a person like that, we can sometimes choose a drug that actually works a bit better. And then it's more favorable because you don't have as many side effects, because you can have the opposite where it's a drug that you actually don't detoxify well at all. So then you're more likely to have all the side effects because you're not getting rid of it very quickly. Mm-hmm. If you already know you have a clotting tendency, adding some vitamin E after surgery is indicated. That's a very easy thing to do. And most people who have like generally clotting disorders, even like factor V Leiden or other things like that, we can just very gently stimulate anti-clotting procedures, especially if you're going to be lying down. Because in a surgery where you're immobilizing a limb and you're not really able to move it in the early days, If you know you have a coagulation risk, these are worthwhile things to think about because that can be very painful and an additional hospitalization on top of your surgery. Now, I'm just going to like replicate a little bit of what Josie said before. You can never underestimate the home care parts of like being prepared to be at home after a surgery. Never underestimate the power of like multiple cushions. They make some beautiful cushioning systems nowadays for to like kind of isolate one part. So, you can get shoulder cushions where you can still be side lying even with a surgery where there's a full body pillow around you and ways of like putting your arm through a set of cushions and everything being adjustable. And so they're worth the investment if you know you're going to have a longer recuperation. Also, movement supports. There's lots of companies in Calgary and probably any city that you're in that rent lots of rehab supplies. And so just consider how you're going to get around your house, whether or not you can walk, how you're going to do toileting. We've always found that lazy boy chairs are like if you have one at home, that's not a bad place to be because they usually recline almost the full way and they're easy and they're soft, so you can get a lot of pillows and stuff around them. Or if you know you can walk, but you're going to need some assistance getting up, like in a joint replacement, you can rent a lift chair. So it's like a lazy boy, but it actually brings you kind of almost all the way up into the standing position. So lovely things to think about. Walkers, crutches, sometimes just an office chair, like on that has wheels that you can kind of like manipulate. You might need to sit down, at least you can roll yourself to the bathroom as long as there's a clear path. And Josie also talked about having food ready. Don't underestimate like just having a week's worth of whatever you need already sorted out and ready to go. Of course, you can enlist friends and family if you can manage that, but what I've seen is that sometimes one partner will be substantially better at supporting this post-surgical process than the other partner. So you just want to like think about that in advance. Also, things like having ice on hand, ice bags, ice pack pumps. We can see now these pumps where you can basically put ice and water in, and it has a recirculating pump through a attachment that can like wrap over a shoulder or over a knee, and it just helps you to. It's less messy. It's got a nice intense cold on it, so it can really help in pain control in the beginning. So heating pads if needed. If you already know that you kind of prefer heating pads, or like you have a belly surgery, sometimes that feels a lot nicer in a belly surgery. So having those things on hand if you don't already have them in the house. Grounding mats can really help reduce pain and clotting complications. So grounding mat is something that's actually wired into the ground of your house, and you need to put bare skin on it, but it actually helps to kind of divest you of all sorts of like electromagnetic charges, and it often actually smooths out pain. And can really help to, like I said, you can do them in the house now, but if it's a possibility to go outside and actually put your feet on the ground, you should take that opportunity too. And if you are expecting to have like difficulties with swelling afterwards, having some like lymph drainage or lymph support stockings on hand of various pressures may also be a consideration. Sometimes we kind of wait a little bit too late to get that rolling if somebody's swelling is really not coming down. There's also gentle lymph drainage techniques that you can use to improve the movement of the fluid that's returning alongside of your venous fluid. Most of the time when you get swelling, a lot of it is going to be in the lymph, backed up lymph. Now, I do have on the surgical handout all the recommended products that we usually use in clinic. Even if you can't get a hold of those particular things in your community, you can always see what's in those particular products. So you can actually go to our FullScript account, and here's like the link where you can actually make your own account. And then this is the link that actually goes directly to the surgical product selection. So pretty much all the things on the surgical protocol are contained on here. But you can also, on this website, find a lot of other professional products and natural, like personal care products and cleaners and stuff like that. So lots of people like to have a FullScript account just for that. For us, FullScript ships from Toronto, and there's a 10% discount off the retail on our account, and the shipping is free over $150, which, let's face it, is pretty easy to hit on supplement plans nowadays. So that'll give you an idea if you are looking for something similar to what we would be using in clinic for support. It'll give you some ideas of what those products contain and what forms of the nutrients they have in them. So I think that's all we had to say from today. So hopefully that's kind of reinforcing for everybody, and they have a couple of ideas to move through their surgery plan with. And Josie, once again, like such great thanks for you to kind of come and do this other aspect, which I'm not totally 100% familiar with, all of the things that have to be done physio-wise. So it's great to have you as a resource.
Thank you.
To the community.
Yeah, thank you. It was great.
Awesome. So I hope everybody has a wonderful evening and that you take our advice and get prepared for your next surgery.
Absolutely.
All right. Take care, everyone.
See you.
Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.